We are back to our show Sunshine. Now it's time for our first interview segment. So our digestive system is sensitive and need to be protected from all the bad habits and also stress as well. So let's introduce our guest for today. So Dr. Ghanem Alsalem, he's consultant of the internal medicine and gastroenterology. Hello and good morning.
Good morning to you and thanks for having me on.
It's our pleasure, Doctor.
Thank you very much.
So first of all, we'd like from you to introduce yourself for our dear viewers.
Yes, as you know, as you introduced me, thank you very much. My name is Dr. Ghanem Alsalem. I am a consultant in gastroenterology and internal medicine. I work in the private sector and I do clinics, and we do a lot of examination for patients, and we manage them with their digestive diseases. Try our best to give them a healthy digestive tract and a healthy system and a healthy life.
Wow.
So healthy digestive for the healthy life.
Yes.
I will take this words from you. This is your slogan.
Yes.
And I will ask you about it. Today, our digestive system have too many problems.
Yes.
Some people have too many severe disease.
Sure.
So what makes the things we do, our bad habits, to imbalance our digestive system?
That's a very good question. Let me tell you something. The most common disease, or one of the most common diseases in Kuwait, is diabetes. And it depends on what you eat, diet. So the other thing is your fatty liver is what you eat. Your hypertension, your raised blood pressure is what you eat. So a lot of diseases here in Kuwait, especially, and worldwide as well. I also include ischemic heart disease, your heart attacks. It depends on what you eat. So your digestive system, it depends on what you eat. If you eat wrong, you will develop bad conditions. You need medical health, help. The thing is, if you have a healthy digestive system and you have a healthy life, you will have definitely a balanced, healthy life with a healthy body. And we always try to deliver this information to our patients. We want them to be not patient, we want them to be healthy people. And to be a healthy people, we need to educate them about what they eat and how they maintain their digestive tract in a good position. Your digestive tract, it's where you actually produce enzymes, you produce hormones, you eat and then you digest and then you take what you eat inside your body. So it depends on what you eat exactly. This system needs a healthy system with education. It's our job, and you are helping us by introducing us to the viewers, to tell them what to eat and how they eat it healthy and how they practice a healthy life.
Because we both, our job is to share the awareness from your clinic,
sure,
inside the hospital, from throwing the camera.
Exactly, as is to share the awareness for our dear viewers, how to eat and how to have a healthy lifestyle.
Exactly.
So at the present, we can see many people, they have irritable bowel syndrome.
Yes.
This is the really most common disease here in Kuwait. What is the cause of it, doctor?
Yes, let me tell you about the irritable bowel syndrome. We call it IBS in short.
Yes.
So the irritable bowel syndrome is everywhere. You go to Duania, they will talk about it. You go to the clinic, they will talk about it. You walk on the street, they will talk about it. Whenever I go, I tell them I'm a consultant in gastroenterology. Oh, doctor, I have my colon. It's really bad.
Yes.
See, the IBS, or the irritable bowel syndrome, is a common condition. It's not a disease. It's a health. It's let's say health condition. Okay, it's a group of symptoms. That's why we call it a syndrome, because there is no underlying really a matter or no pathology, or there is no really a disease. So it's a group of symptoms, and these symptoms don't give you a healthy life. They will always make you disturbed. You will feel full with little amount of food. Your tummy will be really big with time, and you eat little things. Doctor, I feel heavy, my tummy is really huge, I have a lot of gases, I cannot go to the toilet and pass, normally. So these are group of symptoms they come to the patients. This is irritable bowel syndrome.
Yes.
And really, when the patient comes with these symptoms, we need to go through a lot of investigations to make sure they don't have other things. So what causes irritable bowel syndrome? There are multiple theories for it, but I will discuss the most common theories, which I think is the combination of the two. One is the brain-gut axis, we call it. There is a track of neurons or nerve cells from your brain down to your tummy, down to your GI tract. And if you are too much worried, or if you are stressful, or if you have too much thinking of a plan, or if you have, your life is not really going the right directions, this makes your brain works a lot, fire neurons with a lot of signals, they go down to your tummy and makes you feel uncomfortable. That's one theory. The other theory is your microbiome, this your good bacteria in your bowel and the bad bacteria in your bowel. We have a lot of numbers of bacteria in your bowel. The number of bacteria cells in your bowel is actually greater than your cell bodies. So these are a huge population of microorganisms living inside you. If they get disturbed with a lot of things, for example, antibiotics or other medical conditions or anything, that you will have imbalance between these bacteria, and then you will have developed symptoms.
So speaking about the symptoms, speaking about the habits, you talk about the common things about the IBS. So people inside the Diwaniyas always talking about the IBS, the problems. We see Diwaniyas, we've been to Diwaniyas too much. But the thing, all the thinking about the IBS, about the food, about the mood, about thinking about the migraines, about thinking too much. So this is the most common things about the things will affect it, or there's something else, doctor?
Yes, that's a good question. Yeah, there are other things also can cause it. Sometimes you develop the IBS symptoms for side effects of medication. Sometimes you develop the IBS for stressful things. Sometimes actually you develop IBS for temporary time, and then it goes with time. It will disappear immediately. You go to the Diwani, everybody now, the viewers, they have some sort of IBS symptoms. Nobody can, with our modern life, most of this, and I wouldn't say all, so most of us will have these symptoms. But these symptoms, sometimes they come mild, and you can cooperate with them, and you can live your life with it normally, but sometimes it becomes severe. You really need help to overcome them. But the point is, I want to tell you something, and I want all the viewers to listen to me, and this is the most important thing for this view.
The camera with you?
Thank you very much. There are symptoms. If you have them, they are not IBS. You need to seek a medical help immediately. If you see blood in the stool, if you lose weight significantly, and you're not doing any exercise or anything, and you start to lose weight with no reason, and if you wake up from sleep from pain, from tummy. These are three symptoms, actually alarming signs. They don't indicate that this is not IBS, there is something else, and you need really an immediate medical help to seek the reason for this. So I repeat them again: blood in stool, significant weight loss, or you wake up from sleep with pain. So these are the three symptoms. They are not IBS. So when you go to the Douaniya for your friends for next time, and they start to talk about their experience with the IBS, ask them these questions.
The three things.
Three are
do you have already one of these three?
Yes, exactly. And if they do, tell them this is not IBS. Go to see your doctor.
Yes,
so
even in women Douaniya.
Yes,
of course.
Of
IBS actually,
of
even
course.
from the teenagers. So I see a lot of teenagers now from 14, 15, because they are stressed. They had a stressful life from the studying, from the college. They have the IBS.
Excellent, and I emphasize on your point. Actually, recently after the COVID crisis worldwide, we are seeing young patients with these. COVID has a psychological impact on a lot of people, young, old, middle age, everybody. So really, what your point is really great. I urge all parents to take care of their parents, to their children to the best, and understand these symptoms. Actually, they need help, especially with the young patients.
Exactly, doctor. So the question is, how we can calm our digestive system?
That's a good one. Now, if you have IBS, then we usually ask you to do your lifestyle to change. So the cause of the IBS, I will say, is your stressful situation and your diet habit. So we ask the patient to start to do exercise. If you walk every day for half an hour, it's good for you. 5 days a week, and 2 days you take rest. It's very simple. Just 30 minutes of your life, your 24 hours period of the day, just take 30 minutes for walking. It's good. Or if you can do any kind of exercise, swimming, playing soccer, playing squash, whatever you want. Just do some kind of exercise, it's good. The other thing is we ask the patients to actually look at their diet. Sometimes the diet can cause these, make your digestive tract angry, for example, okay? Some of these diets, we don't know them. You're the only one who can know what kind of diet suits your bowel. So you can do a food diary. You write down, when you have the symptoms, what did I eat today, such and such, and you will find out some of these food, they actually cause a problem. There is one study, a big one, and it indicates that, we call it the Fodmap Diet, and our viewers can Google this, FODMAP diet. This kind of diet is good for patients with IBS, and I advise them to follow this kind of diet, and they will really have a relaxed bowel and more enjoyable life.
So, Dr. Ghanem, the good thing that you already told to the viewers, that you are very into your major, like you, excuse me for my voice because of the cold.
Yes.
So you are very into your major. Even you are giving like a sign to the viewers, like you are doing like sharing awareness.
Of course.
And maybe you would like, this is like your new rule now.
Yes.
Sharing awareness before you come to me.
Exactly,
So
that's what we try to do, to make the patients or our viewers, they are not patient yet, and I hope they will be no patient, is educate them. We want to prevent the symptoms, and by prevention, we reduce the amount of patients coming to the clinic. We have a healthy society and a healthy community. And you know, that's...
And sorry for interrupting, so you go to the slogan, prevention better
Exactly.
is the first of the cureness.
Of course, exactly.
So from the calmness of the digestive system and even your colons, how can the IBS get inflamed, doctor?
Yes, so we say not inflamed, but we say you irritate your bowel, or
Change.
change it, or make it more angry or more symptoms. So if you don't follow the good habit of life, if you don't do exercise, or if you actually eat bad, then your bowel will be really not good. For example, I'll tell you something. In our community today in Kuwait, most of our food, especially with the winter time, is during night. And people eat a lot during night, heavy meals during night. That's not good for your bowel. And I always advise our viewers not to do that. This is very bad habit. Eat a lot.
Especially in the winter season.
Exactly,
Yes.
especially in the winter season.
They have it like 3 times dinner.
Yeah, exactly, exactly. It's a
times,
long night and they say, oh, I'm still hungry. So try to resist this. And if you are hungry at night, try to eat light. You know, fruit, vegetables will do the job. They will make
I would
you
drink
feel.
some water.
Or drink some water, or
Yeah.
drink some cold drinks, for example, or hot drinks during the night if it's very cold. Some soup will be doing good. But if you eat heavy meals, rice, chicken, meat, love, you know, fatty foods and stuff like that will really, really make your bowel angry, and you will not have a good night, and you will not have a good day the after day and the second day. So I always tell them prevention is better than going to the doctor. So to do that, just do education, relax, and enjoy the life.
Relax and enjoy the life. Mention about the relax. You just mentioned about walking, and that will relax the body and relax the bowel system.
Sure.
So, how important is mental health for the IBS?
Oh, it is a great question, because most of your IBS symptoms actually occur during your mental, let's say, disturbance.
Yes.
If you are too much angry, or if you are too much happy, that's excessive happiness or excessive sadness or excessive anger will always make your bowel unstable, because this firing of neurons inside your brain will affect your bowel as well and makes you feel uncomfortable.
Even
So
the excessive happiness.
yes, also excessive happiness. If you are, you know, happiness is good. Everybody wants to be happy, but sometimes it's too much happiness is not good. So we advise everything to be balanced, especially those who have IBS symptoms severe. So, you know, your mental process of thinking and, living your life and dealing with the daily activities of your life, going to the shop sometimes makes you angry. Driving the car sometimes makes you angry. You know, talking to your friends sometimes. You know, this is life. Everybody has these things.
Circumstances happens, everything happens.
Exactly.
Yes.
We want you to control these symptoms. We want you to control your anger, control your stressful situation. It's difficult. It's not easy. It's easy to say, but difficult to do. And really, it is difficult. But if you find difficulties in doing that, seek help. There is always people in the clinic will help you to do that.
And
Yes.
there's something in my mind. You already mentioned about the IBS system. About the mental, also my co-host Sarah said mental is the major thing.
Yes.
What about the food, the certain the food that will affect our IBS? Because people say, don't go to eat this type of food, it will cause high severe of the IBS. So what about the food will major or highly damage the IBS?
Yes. So it depends. The foods differ from patient to patient.
It's different about the body itself.
It depends from individual to individual. But we say the main foods they can irritate your bowel. The food contains a lot of fermentation or a lot of fiber. These kind of food maybe will develop your symptoms a lot or make your symptoms worse. So we advise you to avoid these. Now I always tell them to do the food diary, as I mentioned before. You write a note of the food that affects you. Make the symptoms severe. So write them down on a piece of paper. With time, you will know what to eat or what to avoid. But mainly we say, not the type of food, also the habit of food. You know, eating too much. If you're eating when you are full, there is no need to eat. If you're full, But in
the-
Kuwait, you always want to taste everything. This is a
Yes.
new sweet, come on, and you don't do that. Just try to adapt a healthy, healthy diet habit and a healthy diet.
Amazing.
Yes. Yes,
So
even for the milk, the
Yes.
lactose free,
Yes.
I just realized that it's really harm my
Yes,
bowel.
of course.
So someone, even all the patients need to educate themselves to know their body.
Yes.
So thank you so much, doctor, for
Thank
this
you.
generous information you
Thank
gave
you
us
very much
today.
for having me on, and I wish everybody the healthy digestive tract and a healthy life.
So thank you so much, Dr. Ghanem. Next time I will be in your clinic, have a coffee with you. Thank you so much.
You're welcome.
Thank you. So all thanks to Dr. Ghanem Alsalem. He's a consultant in internal medicine and